My beloveds, okay, my dear friends, so let's talk about maternal pelvis. Confused questions. No, of course, it's obstetrics, gynecology and obstetrics, obstetrics and gynecology. So several questions that misunderstood, confuse you. Let's go. So, my beloveds, take pens and papers to note. Maternal pelvis isn't a single bone at all. It's not a single bone. Rather, it's a geometrical ring-like structure formed by several, principally two hip bones, ilium, ischium, pubis, the sacrum and the coccyx. Two hip bones and sacrum and the coccyx. Clinical issue of that. Understanding this bony geometry, architecture, 3D, is essential for predicting the feasibility of the vaginal normal delivery. Abnormalities of variations in these bones can impact and do impact the birth process. Next, the pelvis has several key plans or levels or stages. So, for example, we have inlet, mid-pelvis, outlet, that the fetal head must navigate during labor. Clinical importance of that. Each plane has specific dimensions, my beloveds. Contraction or narrowing of any of these levels mentioned can lead to so-called dystocia or dystocia, I don't know how to pronounce correctly. So-called difficult labor, in Greece it's a dystocia, and necessitate interventions like a forceps, actually I don't know if we use or not me, I'm not, thanks God, a gynecologist, vacuum or cesarean section. Next, my beloveds, the pelvic inlet, that is the upper opening of the true pelvis, is typically oval or roundish. Each shape can be assessed clinically using Leopold's maneuvers to estimate fetal head engagement. Clinical importance of that. The shape and size of the pelvic inlet significantly influence the likelihood of the fetal head entering the pelvis. A contracted or abnormal shaped inlet can obstruct labor. To obstruct labor. Next, the ischial spines are bony landmarks within the mid-pelvis. Their prominence and the distance between them, interspinous diameter, are critical for assessing pelvic capacity. What is clinical issue? Clinical importance is the interspinous diameter is the narrowest part of the pelvis. A short interspinous diameter is a common cause of mid-pelvic arrest of a labor. Okay? Now the angle of the pubic arch, sometimes pronounced arc, actually I don't know, I suppose it's arch. So the angle of the pubic arch, the angle formed by pubic bones, affects the available space or the pelvic outlet. So the angle of this pubic arch. So the angle formed by pubic bones. So this angle affects the available space of the pelvic outlet. So clinical importance, the narrow pubic arch can restrict the descent of the fetal head, especially during the final stages of the labor. About hormones, my beloveds, hormones like relaxin. So hormones like relaxin produced during pregnancy cause relaxation of the ligaments that hold the pelvic bones together. Clinical importance. This ligamentous relaxation allows for slight expansion of the pelvis during labor, facilitating fetal passage. However, and remember that's clinical importance, excessive relaxation can lead to pelvic girdle pain. Pelvic girdle pain, the pelvic pain. Excessive relaxation due to hormones, like relaxin. About pelvic shape. Pelvic shape varies among individuals. The Caldwell-Malloy classification, famous Caldwell-Malloy classification, identifies 4 basic pelvic types. Gynecoid, like ladies, most favorable for vaginal delivery, natural vaginal delivery, android, male-shaped, and anthropoid, oval-shaped. And finally, platypeloid, flattened. Clinical importance of that, while not a strict determinant, of course, knowing the pelvic type can provide insights into the potential ease or difficulty of vaginal delivery. The gynecoid pelvis is considered the typical female pelvis and offers the best prognosis for normal, natural vaginal birth, vaginal delivery. Previous pelvic fractures or surgeries can significantly alter pelvic anatomy and impact the ability to deliver vaginally. What is clinical importance? Good. A thorough obstetric history should include any history of pelvic trauma or surgery. Imaging studies may be needed in some cases to assess the degree of pelvic distortion. So the position of the sacrum and coccyx. That's the next point. The position of the sacrum and the coccyx influence the available space at the pelvic outlet. So a prominent or anteriorly displaced sacrum or a rigid coccyx can reduce the pelvic outlet and impede fetal descent. Pelvic floor muscles play a crucial role in supporting the pelvic organs and assisting with fetal descent during labor. Clinical importance. Strong pelvic floor muscles can improve labor progress and reduce the risk of pelvic floor dysfunction, for example, urinary incontinence, pelvic organ prolapse after delivery. Pelvic floor exercises, famous Kegel exercises, are often recommended during pregnancy and postpartum. That's all about misunderstood questions that confuse you during the last exams, several years exams, 2-3 years exams. I hope I clarified them. My beloveds, don't forget to follow and subscribe my YouTube channel Dr. Y, as well as don't forget to follow and subscribe my private Dr. Y Telegram channel. Private. So how to find and subscribe? Easy peasy. You tap in searching mode in Telegram, it's application, and you find Dr. Y. It's me, Doctor like question, Dr. WHY without question mark, of course. Dr. WHY. You find it's a bot. You click start and you choose your plan. It's not costly at all. Find the cheapest one, up to you, for a month, for example. Then you find a lot of questions and answers like this. You can find MCQ questions for each domain, gynecology, obstetrics, surgery, internal medicine, etc., and so on. Students' cheat sheets, present gifts, and etc. So Dr. Y in Telegram. See you. Bye. God bless.